Very interesting topic related to memory and cognition, and especially the effect of acupuncture in reduction of memory and cognition in patients with cancer or patients who are undergoing chemotherapy. And I would like to thank the American Acupuncture Council for putting up this presentation. This phenomena of cancer-related cognition impairment or chemotherapy-related cognition impairment are quite known. Sometimes patients describe it as chemo brain or chemo fog, which means they have difficulty in concentrating. So different normal tasks, even like reading a newspaper or memorizing a simple task, are becoming a chore and becoming a really difficult situation. And the prevalence is very high. If we see 3 out of 4 breast cancer survivors will say that they had some kind of memory impairment or cognition impairment, and it ranges from 16% to 75% and even more, depends on the cancer, depends on the chemotherapy and the length and strength of the chemotherapy. There's been few acupuncture studies which are very promising in their result and are very innovative in the way they look at how acupuncture affects this cognition. One of them look at the effect of acupuncture in breast cancer patients undergoing chemotherapy. It took 80 patients, 40 received acupuncture, 40 were in the control group, and it looked at 2 parameters. One was a biomarkers, which is neurochemical peptides which are released in the brain. The more you have them, they're called BDNF. The higher the BDNF level in the serum level of the patient, the better cognition. The lower, the worse cognition. So it's actually looked at a biomarker that you can see objectively the effect of acupuncture versus the control group. And it took a battery of different tests, like assessment of cognition tests, that the patient had to fill and look at the difference between the patient in the real group comparing to the patients who were just in the control group. And the results were very promising. There's different things that you could see that statistically are different between the group. First of all, in all the tests, the patients who had the acupuncture scored much higher than the patients in the control group. But also the serum level of BDNF, these biomarkers, were much higher in the patients who receive acupuncture comparing to the control group. And when you compare both, there was a good kind of relationship between the higher BDNF level and the higher score in the tests. So this is showing that this biomarker has a significance, and potentially it's another way to understand or later on to research how acupuncture is affecting the brain and affecting cognition, not just in this group of cancer patients undergoing chemotherapy, but generally, even in the general population. And in the control group, there was no significance different on both, not on the BDNF and not on the scoring for the tests. So the conclusion was that acupuncture therapy is an effective treatment for chemotherapy-related cognition impairment in breast cancer patients, although we need to look deeper into the mechanism and look how the BDNF has affected in this group. When we look at the acupuncture point, it's quite interesting. You see that a group of acupuncture points are concentrated in the head, and there is additional points on the leg, like stomach 36, so it affects more, in Chinese medicine we'll say the spleen, the yi, the ability to digest information. Gallbladder 39 will affect the gallbladder, which also nourishes the brain, but it's also a point for the marrow, which is reduced during chemotherapy, and kidney point. And kidney, as we know, and the Z of the kidney is especially important for a long-term memory. So the design was quite interesting. Some point on the head that affects memory and points that affect the postnatal and prenatal qi. Another interesting study was on, it's a kind of very pilot study or initial study, but it was very interesting in the way it was designed. And it was in cancer-related cognition impairment in Chinese group, gynecological cancer patient. But the reason I want to bring this study, because they looked already at 3 parameters. So they look at the assessment, like patient has to fill in the forms. They looked also at the microstructural of the white matter in the brain, because there is a certain reduction in a certain area in the brain when cognition is lowered. So they look at the difference also in the white matter itself in the brain, and look at the different neurochemical peptides in the brain, the DNA. Also, in the small group, there was a big difference between control group and between the real. These are the different points, all of them on the head, as you can see. So it has its advantage and disadvantage. And the patient can determine which points he's choosing according to the patient's condition. This is example for Tai Yang point on the head, which can be also used for other headaches and other problems in the head when we use it normally in acupuncture. And the results were very interesting because, again, there was a better scoring on the test, although the group was very small, but also there was a difference in this microstructural side of the brain that is related to cognition, especially at the hypothalamus. And the BDNF, the NAA level was also higher. So also this peptide, which you can isolate from the serum, was higher. So we are moving into kind of a new era of research. And first, let me say a word about acupuncture and cognition and memory. In acupuncture, we look at the body-mind-spirit approach. So in the body, it very much relates to the kidney and to the jing, and the strength of the body and the vitality of the body. The stronger the vitality of the body, the better the memory. On the mind level, we look at the yi, we look at the spleen, we look at the different aspects of ability to think and to assimilate memory and bring things from memory. But additionally, in Chinese medicine, which is not difficult to put in research, we also look at the spirit, at the Shen, and the heart, which gives this kind of coherence of self-awareness and general coherence. Although when we look into chemotherapy, we need to look also in other aspects of phlegm and toxins, I will touch on in a minute a little bit more. So now we are looking at a different paradigm of research, when actually the researchers look at the body of, like in functional MRIs, we look at brain structures, biomarker pathways, and different neurobiological systems which are affected by acupuncture. On the mind, patients will do the cognition tests and can be compared, but still hopefully in the future we'll also give space to something which is more, in Chinese medicine we'll say the spirits, the presence, the ability of self-awareness and being in a good awareness, not just for cognition for tests. So this integration of Chinese medicine into especially oncology has a very promising future. I would like to mention that we are looking at very much at the skills that acupuncturist needs in order to treat cancer patients. And in the TCM Academy, we've developed a very unique and international course, very deep course, that looks into the core competence that one's need in order to treat cancer patients. And as you can see, like cognition and memory is just one aspect. Chinese medicine, and especially acupuncture, has been shown with evidence to help in many other conditions. And when we are looking at teaching the core competence, we're looking at the Western medicine understanding and research, we're looking at the Chinese medicine understanding, and also generally we can look at the evidence that are available there and see how we can conclude for evidence. So in this International Oncology Acupuncture Certificate course, we go deeper into understanding this and covering many conditions, especially many conditions that there is already evidence for them, helping acupuncturists to become well-equipped to treat cancer patients. So we look at different conditions such as pain, nausea, vomiting, fatigue, dry mouth, and a big list of others in order to equip the acupuncturist with the best knowledge and the best core competence to treat cancer patients. So I hope you enjoyed the presentation. I would like to thank you very much. If you have further questions, you can write to me, and all the very best. Be healthy and well. Thank you very much.